I'll let you go first. Well, we've been working now the past several months on reforming our healthcare system, and that includes both private option and Medicaid. We did hire a consulting firm, the Stevens Group, who has done some really outstanding work, giving us data, taking a look at several different things, both within the private option and with our Medicaid system, to try to give us the best knowledge, the best things that we can possibly have in order to make the best decisions. And basically, up till now, we have been discussing about where we are as a state. How many people do we have on Medicaid? How much is it costing us per member per month? Where we're at with the private option. Some of those types of things. Some of the different programs that are surrounding, because Medicaid is not just somebody necessarily going to the doctor. I mean, you've got the different parts of it as far as folks who are on disability who have Medicaid, the Our Kids program that's also part of Medicaid as well. And so it's not just, just regular working individuals who are semi-healthy that are on our Medicaid system here in Arkansas. And then, of course, you've heard the whole verification process, and we've spent a lot of time on that as well to make sure that those who are on our system are supposed to be on our system. Okay, and so you've heard, especially with the private option, some 50 or 60,000 people who had questions about their eligibility, and so that's why we sent letters out to them and say, hey, there's some question about whether or not you're eligible for the private option or whether or not you're eligible for Medicaid, and we need some more information. And so you've heard a lot about that, and of course, we've been dealing with that. But what we want to do is we want the most conservative healthcare system that we can possibly get. That was the reason why I signed up for the task force. That is the goal that I have in mind. That's the goal that I've had since day one. All right, is to not just repackage the private option and try to sell it to you folks, but to try to get the most conservative thing that we could possibly get, knowing that we have an administration in Washington, D.C. who might not be friendly to the ideas that we put forth. But that's okay, because again, even if they say no, we're going to push those ideas. Because it's our hope that one day we'll have a more friendly administration to be able to do that. So last month, if you had not heard, the governor did lay out his 7 points that he wanted us to look at when we look at solutions. And folks, there have been a lot of things that have been read into what he has said that may or may not end up being that way. Some folks have said, well, all he's doing is repackaging the private option. Again, I don't take it as such. We can do a lot of things, because there's been probably the biggest talk is number one, is saying businesses, you have to provide health insurance for your folks. You can't just push them off on the private option. So it's been saying, okay, businesses, if we're not going to allow you to just push your folks off on the private option. And then he went in and saying, okay, how are we going to keep those employees with health care coverage? And as I've said before in our discussions, to me there's a big difference between telling somebody you have to go to a government-run exchange and you get a subsidy if you pick one of these plans that the government deems qualified. And that's the way that you get affordable health care coverage according to them. The other end of the spectrum is to give folks tax credits. And that's where the huge discussion, that's where the governor, I think, wanted to go, is that those folks that are currently on the private option, how do we give them more freedom and do it in a more conservative way? And the thing is if we can give either the business, like if they're working, and again, in his, what he did was he tried to put them into two groups. He's like, if they're not working, then they need to go on traditional Medicaid. And I'm not sure that I agree with that, because again, you're adding more people to a broken system. All right. But as an incentive, they're like, if you work, then we're going to allow you to keep private insurance. And again, this is where there have been a lot of folks, kind of, okay, what is that going to look like? And that's including myself. Is it going to be a tax credit to the individual for them to go out and purchase their own health insurance? Are they going to be forced, if we give them a tax credit, to go on to the healthcare exchange and buy a plan? Is the employer going to be giving some kind of tax incentive to make sure that they offer that employee in insurance? And again, is it where that employee is forced to go to the health exchange, or will they be given freedom to maybe purchase some employer plan? So those are the questions that we're asking. Those are the details that we want to get. We're also having to deal again with the federal government. What will they allow us to do? And as always, I'm continuing to take suggestions from folks. Is this an idea? Is this a conservative idea? Is it something that you think that we're just repackaging? Is giving you a tax credit and allowing you to go purchase your own health insurance, is that a conservative idea? Or do you feel, well, that's just tax credit money in a different way? And so these are all the questions that we're trying to answer in the task force. Is there a completely different solution? We would like to go with charity care. That was one of the things, but the governor was like, well, unfortunately, because of Obamacare and even the private option, we've seen some of our charity clinics completely go away because nobody was going to them anymore. And so what it did is it made people more dependable on government, and it did away with kind of the charity aspect of it. And it's not good, exactly. So now we're left with less charity clinics. We're also, looking at, the community health centers that are already in place around the state. Do you just try to direct people to that, and how do you do that? And then also the uncompensated care with hospitals. So those are all the things that we're continuing to work on the task force. But we've gone now from kind of where we at to where we want to go. And we're just starting that process. Hopefully have some recommendations in the final report ready by December 31st of 2015.